Have you ever realized that climbing stairs, once simple, has now become a step-by-step challenge when you place your foot on the tread? After age 50, many people begin to feel their legs tired, an intense battle, and breathless as soon as they make it up a few flights. Everyday activities that used to be familiar, going upstairs, descending to the bathroom, or stepping up to work, all become obese. This not only affects one's natural psychology but also harbors risks of slipping, injury, and reduced quality of life. So how can we halt the decline in strength and restore our legs' performance? Healthy legs are the foundation for maintaining quality of life and independence after age 50. Golden legs help you carry out activities such as walking, climbing stairs, and carrying things with ease, reducing the risk of falling. A healthy body also supports circulation, mild edema, and suffering. Conversely, weak legs limit movement, foster dependence on others, and sap confidence. Therefore, training and protecting your legs is a priority to ensure safety and longevity. Before beginning the journey to increase leg strength, you'll want to know where you're watching from, what city or village. Leave a comment below so we can connect and share experiences. You can also ask questions about methods, exercises, or difficulties you're encountering. Each of your queries will be a precious tip source to fine-tune the content, helping you and the community find suitable solutions. Don't wait to share your thoughts, looking forward to hearing from you. Sarcopenia, or muscle loss due to aging, is the process by which the body's muscle mass and strength decline over time. The primary mechanisms include muscle atrophy, fibers gradually shrinking, and a reduction in fiber number due to decreased protein synthesis alongside increased breakdown. When both the number and size of muscle fibers diminish, contractile ability weakens, limiting mobility and heightening fall risk. Early detection enables timely implementation of resistance training and protein-rich nutrition to preserve muscle strength. Sarcopenia begins around age 30, with a gradual decline in protein synthesis and fiber repair. This stage may not be obvious but shapes long-term exercise and nutrition habits. After age 60, muscle atrophy accelerates, and both muscle strength and mass shrink, impairing daily function. Early awareness and engaging in resistance training 2 to 3 times per week alongside a protein-rich diet starting in your 30s help prevent muscle loss. Maintaining flexibility and independence in older age. The consequences of sarcopenia are severe. Muscle strength noticeably decreases, making everyday movements, such as standing up, sitting down, or climbing stairs, difficult. Impaired mobility slows walking speed, produces an unsteady gait, and reduces balance. The result is an elevated risk of falls and injuries, especially when traversing uneven surfaces or in low light conditions. Early recognition of muscle atrophy allows proactive intervention, minimizing risks and preserving long-term independence. To combat muscle loss, combining resistance training with proper nutrition is key. Each week, you should perform 2 to 3 strength sessions using exercises with resistance bands or light weights. Simple movements like squats, lunges, or band stretches stimulate muscle synthesis, boost strength, and improve endurance. At the same time, consuming adequate daily protein is essential. Prioritize high-quality sources like chicken breast, eggs, fish, yogurt, and legumes. A dietary intake of about 1.2 to 1.5 grams of protein per kilogram of body weight helps muscles recover quickly and develop optimally. Peripheral neuropathy in people over 50 is often discovered from 2 main causes: sugar withdrawal and vitamin B12 deficiency. In diabetic patients, prolonged high blood sugar causes total damage to the myelin sheath of nerve fibers, resulting in numbness, pricking, and leg muscle weakness. Vitamin B12 deficiency, due to insufficient diet or near absorption, reduces myelin synthesis, making nerve signals transmit cheaply. Current development and early adjustment of blood sugar together with B12 supplementation support time to help develop nerve exploration. Symptoms of peripheral neuropathy begin with a feeling of numbness and pricking in the feet, spreading upward to the calves. Many people describe it as feeling pricked by needles, loss of sensation, or burning pain even without any impact. Leg muscle weakness is also common, causing the legs to feel dispirited and lack the strength to stand up or sit down, making movement difficult. When these symptoms occur frequently, Climbing stairs or stepping down thresholds becomes a challenge, affecting quality of life and increasing the risk of falls. Peripheral neuropathy in the elderly drags along a heavy burden for the legs. Tendon reflexes decrease at the root and may react slowly to a loss of balance. Walking becomes unsteady, and the legs slip easily on uneven surfaces. The feeling of incompleteness forces them to use pens or walking frames. Reduces activity, and increases the risk of falls. Gradually, fear limits their level of movement, thereby making life rudimentary and diminishing in quality. To control peripheral neuropathy effectively, keep blood sugar stable through a balanced diet, exercise regularly, and take hypoglycemic medication as prescribed by your doctor. At the same time, supplement vitamin B12 through meat, fish, eggs, or pills, and even injections when necessary, to help protect the myelin sheath of your nerves. Periodic checkups and B12 energy tests every 6 months will detect early deficiency and adjust supplementation appropriately, thereby compartmentalizing pure nerve damage progression. Vitamin D plays an important role in helping absorb calcium in the small stomach and maintaining calcium phosphate levels in the blood, consolidating bone structure firmly. In addition, vitamin D supports muscle function by providing the basis for protein synthesis. Vitamin D deficiency causes reduced muscle strength, easy fatigue, and increased fall risk in older adults. Therefore, sun exposure, consuming foods rich in vitamin D or taking supplements is necessary to protect the musculoskeletal system. In the elderly, vitamin D deficiency usually arises from 2 main reasons. First, sun exposure time decreases because of a lifespan spent rarely going outside, causing the skin not to synthesize enough vitamin D. Second, the ability to metabolize vitamin D declines with age. The liver and kidneys become more cautious, reducing the efficiency of converting provitamin D into its active form. These 2 factors combined lead to low vitamin D levels, clearly preempting beneficial effects on bone and muscle health. Vitamin D deficiency not only reduces muscle strength but also raises fall risk in the elderly. When vitamin D levels drop, calcium absorption declines, creating precious muscles and quick fatigue. This muscle weakness also impairs nearby reflexes, making it hard to maintain balance and sense foot placement when moving on slick or uneven surfaces. Studies show that elderly people lacking vitamin D have a significantly higher fall rate, leading to serious injuries and reduced quality of life. To address vitamin D deficiency, you should take advantage of early morning sun for about 10 to 15 minutes each day. At the same time, supplement with foods rich in vitamin D such as salmon, cod liver oil, eggs, and fortified milk. When diet or sun exposure is not enough, vitamin D3 tablets will support maintaining proper levels. In addition, periodic testing of vitamin D levels by blood assay helps adjust supplementation amounts appropriately. Protecting bone health and muscle function. Use it or lose it reflects the consequences of a life with little activity. When muscles are not used regularly, the number and size of muscle fibers decrease, leading to muscle atrophy and weakened endurance. Less movement also slows metabolism, increasing chronic risks such as diabetes and cardiovascular disease. A dynamic lifestyle, with activities like walking, climbing stairs, or gardening, is the key to maintaining muscle mass, improving circulation, and protecting lasting health. A life with little activity causes rapid decline when muscle fibers are not activated, reducing their number and size. Endurance capacity declines, making walking, climbing stairs, and carrying things back and forth difficult. At the same time, inactivity slows metabolism and negatively affects circulation, insulin regulation, lipid balance, and leads to weight gain. This change gradually lays the groundwork for chronic diseases such as diabetes, cardiovascular issues, and obesity, reducing mobility and quality of life. Vitamin D deficiency impacts the musculoskeletal system severely, reducing the ability to play sports and muscle strength. When vitamin D levels are low, the process of calcium absorption at the ribbon and bone regeneration is impaired, while vitamin D receptors on muscle cells function inefficiently. As a result, leg muscles become weak, tire easily, and struggle to sustain movement. Moreover, reflex irradiation declines, making the elderly increasingly prone to falls and more serious injuries. To address vitamin D deficiency, you should take advantage of early morning sun for 10 to 15 minutes each day to help the skin synthesize provitamin D. Supplement foods rich in vitamin D such as salmon, mackerel, cod liver oil, eggs, and fortified milk. When diet and sun are insufficient, vitamin D3 tablets are an effective solution to maintain stable levels. Periodic testing of 25O-D concentration helps adjust supplementation appropriately. Protect the musculoskeletal system, and reduce fall-related muscle injury. Osteoarthritis develops when the cartilage covering the ends of bones gradually wears away due to aging and repetitive stress. Once the cartilage thins or hardens, exposed bone surfaces rub directly against each other, causing inflammation, pain, and stiffness, especially during movement or after periods of immobility. Patients often avoid bending the knee or hip to reduce discomfort, which limits joint range of motion and weakens the surrounding muscles. Over time, this impairs daily activities, accelerates muscle atrophy, reduces load-bearing capacity, and raises the risk of dangerous falls. Because of joint degeneration, older adults tend to shun flexion movements to avoid pain, leaving muscles such as the quadriceps, gluteals, and hamstrings understimulated. Gradually, these muscle groups atrophy, losing both strength and endurance. As a result, basic actions like standing up, sitting down, or climbing stairs become exhausting and difficult. Reduced joint stability under load further increases the chance of imbalance, falls, and serious injury. Treatment strategies for osteoarthritis include low-impact exercise, targeted muscle strengthening around the affected joints, and medical intervention. Activities like cycling or water aerobics reduce joint stress while building supportive musculature. Gentle squats and lunges performed with moderate resistance help stabilize knees and hips. In cases of severe pain, non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroid injections can alleviate symptoms. For advanced disease, arthroscopic surgery or full joint replacement may be required to restore function and provide long-term pain relief. Medical management of osteoarthritis combines multiple approaches to relieve pain and improve joint function. NSAIDs reduce inflammation and discomfort, while injections of corticosteroids or hyaluronic acid into the joint prolong anti-inflammatory effects and enhance lubrication. When the disease is advanced, arthroscopic procedures or prosthetic knee or hip replacement can rebuild joint structure and restore mobility. Integrating medical treatments with resistance training and low-impact exercise optimizes outcomes, minimizes pain, and enhances muscular endurance. Medication-induced myopathy is characterized by significant muscle fatigue triggered by certain drugs. Statins prescribed for high cholesterol can cause muscle pain, cramps, and weakness. Long-term or high-dose corticosteroid therapy similarly leads to muscle fiber atrophy and loss of mass. Some chemotherapy agents, such as vincristine and doxorubicin, disrupt muscle metabolism, resulting in generalized weakness and fatigue. Early recognition of drug-related muscle pain or tiredness allows healthcare providers to adjust dosages, switch therapies, and minimize side effects, thereby optimally protecting muscle health. Combined with proper nutrition, a combination of cardiovascular and resistance training is key. Activities such as brisk walking, swimming, or cycling for at least 150 minutes per week both burn excess fat and improve cardiovascular health. Meanwhile, 2 to 3 sessions of light strength training per week, using dumbbells, resistance bands, or bodyweight exercises, squats, lunges, will stimulate muscle protein synthesis, helping to preserve and build muscle mass. Finally, monitor your muscle-to-fat ratio with a bioelectrical impedance analyzer to accurately assess your progress. Stroke occurs when the blood supply to a region of the brain is interrupted, either by a blockage, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. Without oxygen and nutrients, brain cells begin to die within minutes, disrupting motor, sensory, and cognitive functions. If the affected area controls leg movement, patients often experience hemiparesis, weakness on one side of the body, especially the leg opposite the lesion, accompanied by imbalance and difficulty standing or walking. The result is a shuffling gait, inability to climb stairs, heightened fall risk, and dependence on canes or walkers, all of which diminish quality of life and increase caregiver burden. Effective stroke prevention begins with strict control of risk factors. First, maintain blood pressure below 140/90ths of a millimeter of mercury through a low-sodium diet. Weight management and antihypertensive medication is prescribed. For those with diabetes, keep HbA1c under 7% by following a balanced diet. Exercising regularly and adhering to glucose-lowering therapy to protect vascular integrity. Atrial fibrillation is another common cause of cerebral embolism. Appropriate anticoagulation under medical supervision can markedly reduce this risk. Beyond medical management, a smoke-free lifestyle and limited alcohol intake are critical for vascular health. Regular physical activity, at least 30 minutes of brisk walking or moderate aerobic exercise 5 days per week, improves circulation, enhances endothelial function, and reduces thrombosis risk. Coupling this with a diet rich in leafy greens, fruits, whole grains, and low in saturated fats builds a resilient cardiovascular system, lowers stroke incidence, and preserves mobility and life quality. After investigating the 10 principal causes of declining leg strength and function in those over 50, from sarcopenia and peripheral neuropathy to peripheral artery disease, vitamin D deficiency, osteoporosis, and stroke, we now have a comprehensive roadmap that integrates physiology and lifestyle. Implementing resistance training, protein-rich nutrition, glycemic and blood pressure control, plus low-impact weight-bearing exercises will maintain muscle and bone integrity. Simultaneously, adopting an active lifestyle, quitting smoking, eating a balanced diet, and monitoring key biomarkers, vitamin D, calcium, B12, safeguard your vascular and nervous systems. In special cases, such as patients on statins or long-term corticosteroids, medication adjustments and ensuring adequate protein and magnesium intake alongside exercise will minimize side effects. Additionally, combating osteoporosis and sarcopenic obesity through periodic bone density and body composition assessments guides personalized treatment and weight management strategies. Managing chronic risks like hyperglycemia, atrial fibrillation, or pre-stroke conditions demands a low-sodium, plant-rich diet and consistent physical activity. To begin, simply choose 1 or 2 small, practical changes. Add a resistance band session to your week or tweak your daily meal plan. These modest steps are easy to implement and you will soon notice improvements in endurance, flexibility, and confidence. At the same time, consult your physician or a qualified health professional to tailor a plan that fits your health status and goals. A specialist can help you determine the precise amounts of vitamin D, calcium, B12, or other supportive supplements you may need. Share your personal experiences, successes or challenges, to help the community learn and grow. Ask questions whenever you need guidance, because every question inspires us to expand and refine our content. Don't forget to subscribe to our channel and watch our upcoming videos on leg health, nutrition, and exercise. Together, we will build an energetic, resilient community full of vitality.